Hi, everyone. This is the February 2026 update for CancerMaps Incorporated. This month marked a huge milestone for CancerMaps. We got our charitable tax status application submitted to the Canadian Revenue Agency. This is such an important step for us. It helped to formalize our governance. It really clarifies our organization as one primary public benefit, and it puts us on a track for long-term accountability, which is so important in terms of becoming a credible and trusted source of online resources for patients and their families as they navigate the cancer experience. The charitable tax status application, because it demands clarity about what the organization is, really informed how we formed our objectives as a corporation, and working with a really defined scope has been helpful in terms of helping guide our steps forward with a lot of discipline. So working towards the goal of getting this application in has been something that has really informed a lot of the things that we've done in the last few years now. So this has been really great to get that in. The decision will likely take 6 to 8 months. There's no guarantee that it'll be approved. We may have to submit more information or revise the application, but for now, the application is behind us, and we can start working on the next tasks to strengthen the foundation of our organization so that our future growth continues to be deliberate and sustainable. And I think, the next big priority is developing our contributors network. So if we're going to create really meaningful resources as an organization, we know that they must be informed by, first and foremost, patients who have experience with diagnosis and treatment, as well as their caregivers and supporters who have helped them navigate, the cancer diagnosis and the healthcare system. And then we also need to have healthcare professionals on board and helping us who understand how the system functions, as well as have clinical practice expertise to help make our resources as impactful as possible. For instance, right now we are working on some resources that focus on the period between diagnosis and the first oncology consultation. This window often involves a lot of uncertainty, a lot of waiting, and a lot of information that's really fragmented. So any tools intended to support people in this period must be grounded in clinical and lived experience, not just assumption. It needs to be really accurate so that we're not making the problem worse for patients and their friends and family. And we need to create an organized system for working with people that have that experience and that knowledge to help us build credible, reliable, and accurate resources. This is true not only for what we're working on right now, but as we move on to tackle resources that cover any part of the cancer experience, whether that's after diagnosis or when people are on treatment or surveillance or in the end of life care part of the cancer experience. We need to be able to collaborate with people really effectively to make sure that we're creating really, really good, helpful tools for people. And as we move forward, I think it's important to be aware of where we are as an organization. So we're really early stages in terms of getting to where we want to be as a sustainable organization. It's important to just be aware that if we move too quickly, we risk building on unstable ground, whereas if we move too slowly, we risk losing momentum. So I think what we're doing is moving with really a deliberate pace to make sure that we're kind of not moving too slowly or too fast. The phase that we're in right now is really about clarifying our roles, both as an organization, what we're trying to accomplish, as well as the establishing and developing roles within our organization so that we can achieve our mission. We're also working on building relationships and designing systems that are capable of supporting long-term impact. So, I think that's where we are, and I think we are moving in a really good, positive way. As we move forward, we really want to hear from people like you. We want to hear, both from people that have experienced cancer firsthand and have that lived experience. And we also want to hear from healthcare professionals who have observed friction points in navigation and have, clinical expertise and experience to inform our resources. We want to hear from you about how you would like to engage with us to co-create online resources for those living with cancer, with the ultimate goal of improving the cancer experience. So I do hope that you'll reach out to us, and I look forward to providing future monthly updates to share progress on how we are building our contributors network and the other things we're working on. If you're interested in staying informed as CancerMaps develops, please consider subscribing to this channel or joining the monthly newsletter. Your engagement will also help increase the visibility of this project, which is super important, and links for how you can sign up for the newsletter are included below. So thank you so much for watching this video, and I look forward to uploading the next month update and sharing what we've been working on and how we're continuing to move forward. Thanks so much for watching.